The CDC is in turmoil, and the consequences are alarming. Hundreds of dedicated staff members have been let go, leaving a trail of uncertainty and frustration in their wake. But what does this mean for the nation's health and safety? The Centers for Disease Control and Prevention, a cornerstone of public health, has been hit hard by recent cuts. Over 600 employees were fired over a long weekend, a move that has sparked protests and raised concerns. The Trump administration's decision to reduce the federal workforce during the government shutdown has resulted in a chaotic and emotionally charged situation. The process was far from seamless, but here's where it gets controversial. The next day, around 700 employees received emails rescinding these notices, leaving them in a state of confusion and limbo. Erin Melton Backus, a specialist with the CDC, has been on administrative leave and received a termination notice 3 times this year. The lack of clarity and transparency has left employees like Backus in the dark, wondering why certain programs were spared while others were not. This situation has led to accusations of intentional chaos and a lack of accountability. The Department of Health and Human Services, HHS, attributed some of the sudden changes to data issues and errors. However, the damage was already done. Approximately 600 CDC staffers were let go, including those who brief Congress, work on vital health statistics, and provide support services. And this is the part most people miss. Even the CDC library staff and mental health support providers were affected, leaving a gaping hole in the agency's ability to function effectively. HHS declined to provide specific details, but stated that the terminated staffers were non-essential. This label has sparked debate, as many argue that these employees were essential to the CDC's mission. The court filing reveals that 982 employees were cut from HHS, including those from agencies focused on mental health and strategic preparedness. The Federal Workers Union is challenging the legality of these layoffs, calling them a callous attack on dedicated workers. Yolanda Jacobs, a CDC specialist and union president, emphasized the risk to the health and safety of both members and communities. The recent cuts are just the tip of the iceberg, as the CDC has already lost around 3,000 employees this year due to various reasons. The impact is far-reaching. The entire staff of the CDC's Washington office was eliminated, severing a crucial link between the agency and Congress. Dr. John Brooks, a former CDC chief medical officer, highlighted the loss of direct access to data and expertise for Congress. This means that lawmakers may struggle to obtain. State and local health departments are already feeling the strain. Dr. Karen Remley, a former CDC official, emphasized that the CDC has always been a go-to resource for health emergencies. But now, when they reach out for help, there's nobody to answer the call. This could have devastating consequences for public health, as the nation's ability to tackle health crises is compromised. HHS has defended the cuts, labeling the federal health infrastructure as bloated. But is this a fair assessment? The debate rages on, leaving many to wonder, is this a necessary streamlining or a dangerous dismantling of vital public health services? Share your thoughts in the comments below.